Hello, my name is Anne Tembo. Welcome to Unit 18, Health Promotion. So we will just start by looking at what is health. Health is when one is in a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Healthcare exists to help us maintain the state of our health, and with good knowledge, individuals can avoid hazards and diseases. And we'll move on to look at what is health promotion. So health promotion is the process of enabling people to increase control over and improve their health. It moves beyond the focus on individual behavior towards a wide range of social and environmental interventions. As a core function of public health, health promotion supports governments, communities, and individuals to cope with and address health challenges. This is accomplished by building a healthy public policies, creating supportive environments, and strengthening community action and personal skills. There are several health promotion campaigns that have proven effective amongst communities, including Help Us Help You campaign that was launched in 2020 by the NHS. And their latest campaign that was launched was on World Lung Cancer Day, which came after figures suggest that people at risk of lung cancer may not be coming forward for care, despite lung cancer being the biggest cause of cancer deaths in England. While most of the cancer referrals quickly returned to pre-pandemic levels after the first wave of COVID-19, lung cancer referrals only returned to pre-pandemic levels in May 2022. Health promotion campaign help warn the public and educate regarding the symptoms. Lung cancer is one of the most serious cancer types in 2021 was the fifth, standing at 22% cause of death in England, accounting for 26,410 deaths. This campaign targets the groups of people most at risk, including the over 50s, over 60s, as well as people from the more working class backgrounds who are often reluctant to visit their GPs, which is critical to getting an early diagnosis. This campaign urged people to get checked if they have had a persistent cough for 3 weeks or more. It built on earlier phases that raised awareness of general cancer symptoms in the autumn of 2020 and abdominal cancer symptoms from November to December of 2020. And yes, just a quick look there, as I have just mentioned there. This campaign raised awareness and let people know that a cough can just not be a cough, it can be a sign, especially if they have had a cough for more than 3 weeks. Yes, so now we will just keep moving here. This national campaign ran across TV, including Catch-Up TV, radio, PR, and social media. And in addition, there was targeted activity to reach Black and South Asian audiences, as well as engagement with healthcare professionals and community organizations. Bespoke and accessible content such as posters, social media assets, and video content in different languages were also created or produced, shall I say, which led to a significant increase in the number of people aware that a persistent cough was not just a cough, but could be a sign of cancer. Raising awareness of cancer symptoms and supporting people to come forward is vital, and this campaign assures just that. Help Us Help You campaign has not just raised awareness on lung cancer, but have recovery from impacts of COVID-19 on cancer services, patient and public voices forum, earlier and faster diagnosis, treatment, innovation, and personalized care across cancer pathway, improvements, collaboratives, and cancer volunteers. The campaign also encourages those who are already being treated for a health issue to keep their routine appointments and those experiencing mental health issues to access NHS services and support. And just to quickly put that up there. And then Better Health is another, Better Health offers several apps to download for free, including a weight loss app that is available to download and help you start healthier eating habits, be more active, and start your weight loss journey. More interestingly about this app is that it breaks down into 12 weeks, so you can set your weight loss goals, use MBI calculator to customize your plan your meals, get more active, and burn more calories during the day while recording all your daily activities and progress. Yes, that is the Better Health app there for weight loss. And there is another 2 apps offered by Better Health. Better Health is a Quit Smoking app. Quitting smoking improves your physical health and boosts your mental health and well-being after as little as 6 weeks of being smoke-free. This app allows you to track your progress, see how much you're saving, and get daily support for those strong daily cravings. Cutting back on alcohol can be really effective way to improve your health, boost your energy, lose weight, and save money. Drink-free days is another app, Better Health, designed to help you drink less or cut down and get support to stick with it. And my favorite one is the Couch 5K app. This app is suitable for beginners and has helped millions of people, and the 5K can be completed in as little as 9 weeks, just to help you get started on your health journey. It is recommended that we get at least 150 minutes of moderate physical activity a week, or around 20 to 30 minutes a day. More than 80% of the world's adolescent population is insufficiently physically active, which means 20 to 30% have increased risk of death compared to those who are sufficiently active. And globally, 1 in 4 adults do not meet the global recommended levels of physical activity, which is alarming for the health professionals. Physical activity ensures healthy growth and development in young people. It enhances thinking, learning, and judgment skills. Physical activity reduces symptoms of depression and anxiety, contributes to preventing and managing non-communicable diseases such as vascular disease, cancer, or diabetes. So this campaign is beneficial to the society and to individuals looking to live a healthier lifestyle. So now we will just move on to my health promotion campaign. Yes, I have chosen a name, Plant for a Better Tomorrow, for my health promotion campaign, which is gardening. So the purpose of this campaign is to encourage people to start getting into gardening activities. Now more than ever, we need to get outside and fill our bodies with fresh air and fresh food. And luckily, gardening is a fantastic way to do just that. Not only is gardening an eco-friendly hobby, but it is also a great way to spend some time as a family, planting flowers, arranging plants, or planting vegetables and fruits while enjoying the outdoors. And reasons chosen for this health promotion will be to create a Facebook page that can be shared on the platform through advertisement. But when promoting this campaign, it is important to consider those who are not on social media, like the elderly. So for the purpose of reaching everyone and all age groups, I will be creating flyers to be distributed in local pharmacies, GP practices, and local shops. And other resources I will be using TV, radio, and newspapers. This is how I will promote this campaign and advertise this health promotion, with the understanding of cost kept in mind, of course. And as this campaign is based on encouraging others to take on a hobby that will benefit everyone involved, I will be including a volunteer program as well for those looking to help connect the community by spending some time gardening with the elderly living alone, or planting flowers to give to a local charity. And this can be available for evenings and or weekends. Yes, so the best time to release this health promotion campaign will be the beginning of spring. At this time, people can enjoy preparing their space of choice, whether it's a windowsill or a small area outside or a community garden. It is important to prepare for your gardening activities like buying seeds, compost, and plants. And also starting your gardening and preparations in early spring will give your plants a long growing season until the winter approaches. Not only does this campaign help us find joy in growing our own ingredients and flowers, but it also helps the wildlife as they start meeting in April. And so the duration of this promotion can run longer than 3 to 9 months, perhaps, to get as many people involved as we can. Content, images shared by the public, and other useful resources will be available on our social media page. To keep this campaign fun and educational, monthly themes will be introduced for this health promotion campaign. I'm not sure if you can read over there, just in smaller prints there. So we have themes that will go by monthly planning. So March, spring color and spring planting. April, plants for summer display and crops. June, scented plants. July, enjoy your plants, play with colors along with your families. And August, plants to excite the senses, like smell good. September, the gift of growing. October, planting with the nature in mind, more green there. November, autumn planting. You can choose plants that can survive that season. So same as for December, winter colors. And so we move on. The monthly campaign themes will provide an opportunity for retailers to promote their products and increase their monthly sales. This campaign will also help existing clubs, gardening clubs, keep it fun in the garden, selecting a wide range of products available in their area and enhance community capacity and knowledge. There is increasing evidence that exposure to plants and green space, and particularly to gardening, is beneficial to mental health and physical health. And so it could reduce anxiety symptoms and stress. It is not only the appearance of plants that is beneficial. Their leaves remove toxins, dust, and microorganisms from the air. They also produce the so-called negative ions from their leaves. Many studies in the UK and other countries concur that higher proportions of green space are associated with less depression, as green space may not be simply related to physical activity, but rely more on improved social interaction. And therapeutic gardens have been used in hospitals for thousands of years and were strongly supported by Florence Nightingale as they improved the surrounding of patients, visitors, and staff. Yes, so as we can see over there. And lastly, looking at how to determine looking at how to determine the effectiveness of this campaign, I will write down my evaluation plan step by step before launching this campaign, and refer to this every month to determine whether it was a success or not, and what can be done to change the negatives and improve this health promotion campaign. So number one, gather community insight. This will help set benchmarks and evaluate efforts before, during, and after this campaign. Number two, message exposure. How much awareness was raised by this campaign, and did we reach the intended audience? Number three, gather media campaign metrics, and This will give a percentage of the public that is exposed to this message planned for a better tomorrow. Number 4, evaluate website metrics. This will give an idea of how many people actually visit the website and learn what this campaign is all about. Number 5, engage in social listening, creating a social buzz by responding to messages online or in person about the campaign. That will create a positive impact there for the campaign. And number 6, the evidence, which is the results. Benefits of gardening for health and well-being. How do people feel about gardening? How has it improved their lives, their social lives, their personal lives? Even if they just own one plant, that will still count. And then yes, because this campaign will run for about 9 months, we will need to continually test strategies, methods, and channels to broaden our audience and have measurable results. All of the above will help determine how successful our health promotion campaign will be if repeated yearly, because we want the community and individuals to continue planting for their better tomorrow, gaining knowledge, contributing to society, and potentially preventing or reducing the number of people admitted in hospitals due to poor health. This campaign will help communities learn about food recycling too, by not throwing away those peels or seeds, but instead regrow them. Yes, there are 152,000 strokes annually and a total of 1.2 million stroke survivors in the UK. A quarter of a million patients are admitted to psychiatric hospitals each year, and dementia is predicted to affect 1 million people by 2025. Few complementary therapies have been convincingly shown to be effective, but gardening and nature, which are alternative therapies, offer a proven, cheap, and nearly universally available means to improve the nation's health and potentially reducing the mounting pressure on the NHS and social services. And to conclude here, with the world population rapidly increasing, it is estimated that up to 70% of people will live in urban spaces in the next 3 decades. This trend has enormous implications for both human health and environment impacts. Urban policies are now supporting the promotion of sustainable health, and healthy lifestyles are urgently needed. Hence, gardening delivers benefits across physical, psychological, and social dimensions of health. Thank you.